Good day, everyone. I hope that this video finds you all doing well. I'm coming to you today from Texas in the United States, and I just wanted to offer you some thoughts about World Rabies Day, which is coming up on September 28th, which is the anniversary, as you know, of Louis Pasteur's death. Since about 2007, we've been doing this day, and it's really about creating awareness and visibility while advocating for global elimination of rabies. And created as an inclusive initiative, this can help unite people, organizations, and stakeholders across all sectors of the world. I have been working in public health and the world of rabies since about 1994. I spent the first decade of my career at the Department of Health in Austin, Texas, where I did a couple of stints training at the Centers for Disease Control in Atlanta. And it was really one of the greatest times of my life. I spent about a decade working as a hybrid professional. So I was on the bench doing the molecular testing. I created the first regional rabies reference laboratory in Texas. And yet I was also able to go out in the field with what was then a very unique and really cutting edge technology called the World Rabies vaccination program. And through that program, we delivered recombinant vaccine to wildlife. I even have these two stickers historically from when I was doing that, where we went out and using Canadian aircraft, we were able to deliver that vaccine all over South Texas and parts of Central Texas, and we eliminated canine rabies alongside the typical importance of dog vaccination, cat vaccination, and other types of rabies vaccination. Why do we really need a World Rabies Day still? Well, rabies is a feared and ancient neglected disease. And while we don't see many deaths in humans in the United States, it still kills about 59,000 humans worldwide. And it's really difficult to eliminate that total global burden of disease because of all the animal reservoirs and species. Just recently in the United States, we had submitted about almost 88,000 animal samples for testing. And, most of them, 98% of them returned a negative test or a conclusive test, but 5.2% of these still tested positive for rabies. And so we still see it in the animal population. We certainly see it in bats. And so that creates a problem of bats moving around and possibly spreading variants to different reservoirs. Likewise, even though we had no human cases in 2020 in the United States, this past 2021, we had 5 rabies deaths, which is the highest count in about a decade. So while we still are, working to educate the public not to interact with strange animals and to never handle a downed bat, and to be reporting bites and teaching children or parents how to be careful around wildlife and bat species and things like that, we still have work to do. And so as we kind of move forward with this World Rabies Day, on September 28th. There's a lot going on. We've just been through about 2.5 years of the SARS-CoV-2 pandemic, and it's still going. And certainly we have the monkeypox outbreak. So we know that zoonotic infections will continue to arrive on everyone's shores and pose substantial and sometimes predictable concerns to our health and welfare globally. And so that is something we need to keep in mind. And we know that with rabies, over about the last 10 years, we've made substantial progress on a global scale regarding pathogen discovery, diagnostics, prophylaxis, education of professionals across academia, government, industry, and even international non-governmental organizations. So to continue that success, let's all commit to this cross-disciplinary philosophy. Let's help promote collaboration among medical and non-medical professions alike within an updated One Health approach. And let's work towards the common goal to better understand, communicate, detect, prevent, control, and hopefully one day eliminate lyssavirus infections within the next decade or so. Thank you all and have a wonderful World Rabies Day 2022.